All right. Well, we have an awesome episode here today. And I've been looking for a while for someone to talk about spine health with all of the different audiences that I work with, from students to colleagues to clients. And so I'm pretty pumped that Dr. Jazini is here to talk about spine health. He's very busy coming from patients, surgery, and all these things. Thank you for giving me some of your very valuable time to discuss this, Dr. Jazini.
You're welcome. I'm very happy to be here and to speak to you. This is very obviously a very important topic. Obviously, as a spine surgeon, this is what I do each and every day. And so I'm happy to share my sort of thoughts and expertise on this topic with you and your audience.
Excellent. No, that's great. And we're going to focus this today really on starting with the basics. As I talked to Dr. Jazini and discovery call I do with all of the guests here, love to get to know the guests, but we really want to not jump too far ahead too quickly, but create an operational definition of what we're actually talking about with the spine. So Dr. Jazini is going to talk a little bit first about the basics of the spine, structure, function, physiology, and then we're going to move on from there.
Yeah, I mean, I think a good way to sort of sum up what we're going to talk about today is that this is really spine health 101, from prevention all the way to surgery. I'll start with just introducing myself to your audience. I'm Dr. Jazini. I'm a spine surgeon here in Northern Virginia, right by DC, at Virginia Spine Institute, also called VSI, which is a practice that's been around for 30 years. What's really unique about myself and this practice is that we are all-inclusive spine institute. That means we have both surgeons, but physiatrists, neurologists, physician assistants, physical therapists, all working together really to help with spine healthcare. Most of what we do, even though I'm a surgeon, is actually non-operative care, all the way from physical therapy to regenerative treatments to surgery, right? So my interest today is to sort of lay out what is spine, what's the function and structure, like as you said, for spine. And, most of us don't think about our spine until it hurts, right? So what we want to do is to talk about what it actually does, why it starts to break down in some people, what you need to do to protect it, right? And what I do as a spine surgeon when things don't go as well, right? And so that's sort of the goal here. So talking about sort of the structure and function of spine, it's best to sort of first build, I would say, a mental model for the audience, right? And the best way to understand it is, well, what is it doing, right? It's a spinal column, right? And so what that means that it's the foundation for your head and your torso, right? It allows us to be upright animals, right? That's how we can stand, right? That's how we can function. The other aspect of it is the spine, as most people know, is not like nice and straight like this, right? It has curvatures, right? That curvature is built in that way in order to provide a spring-like effect. It's a shock absorber. I'm talking about the entire structure of the spine. Then within those columns, right, you have the vertebral bodies, which are basically stacked one on one top of the other. You have the things that are called discs. Those are the cushions that also provide that cushioning, right? The other function of the spine is that it provides a tunnel, a bony tunnel that protects a very vital thing called the spinal cord that sends the information from the brain to our extremities and to the other organs, right? And so it's like that inner cage that you can see pretty much in a lot of the other animals as well that supports and protects that. The last thing that, in terms of structural standpoint, is the functionality piece of it. It allows us to move. It's not a rigid piece that just doesn't move, right? Each of those segments move on top of each other in a very rhythmic but also systematic way, right? That allows you to bend, to twist, to look, right? So we can then break it down into the individual main parts of the spinal anatomy, and these are terms that I'm sure a lot of the audience members have heard, like what's a vertebral body, right? Really what it is those building blocks of bone that are stacked between those cushions called the disc that we just talked about. Then you have the facet joints, which are the hinges. Those are the small guide rails in the back of the spine that allows that motion. And those joints in different parts of the spine allow different degrees of motion, which is important as well. Then you have the ligaments and muscles, which are like the guy wires and active stabilizers. And finally, you got the nerves, those things that send either the power to our muscles or the sensation from the legs or the hands, fingers back to the brain, right? So, you want to think of your spine like a flexible skyscraper, right? The bones are the floors, the discs are the cushioning between them, the joints and ligaments are the connections, and the muscles are the constant active support, keeping it upright and moving smoothly, right? I just want everyone to sort of get the mental picture as we go down to the next topic, which is, well, why does it break down, right? And you can really split this into two different aspects, right? You have the normal wear and tear, and then you have sudden events like a traumatic event, right? The reason I got into spine is from an event like that. My brother got into a really bad car accident as a family, and he had polytrauma, brain injury, spine injury, and really seeing doctors get him back to where he is now, it really inspired me to do the same, right? That was a calling for me as a spine surgeon. But for most people, it's not traumatic. It's really normal wear and tear. Where it gets a little bit more complicated is genetics, right? Ultimately, we are to some degree, our genetics is defines us as people, right? And so where that becomes a huge factor is in some people that normal wear and tear that happens starts at an earlier age versus, they have a more of a propensity to have disc issues at a younger age. So then as that normal wear and tear happens, they start having problems in their 20s and 30s versus, let's say, in their 40s and 50s. But that wear and tear happens no matter what. It's like, you drive a car, the tires eventually will wear out. And the more you drive that car, you're going to wear it out faster. You need to change the tires. Now, there are different brands of tires. So some people are with the top-notch tire, and so it can last a little bit longer. But at the end of the day, it's going to wear out if you drive it long enough, right?
Do we know like the difference, like percentage-wise, genetics, in terms of populate like I don't want to say this, like how big of a genetic contribution is there to the wear and tear between individuals?
It's not simply because there's an interplay. I would say if you say, hey, man, give me a number, I would say it's probably 70-30 genetics to wear and tear. But it's a little bit more complicated than that because there's an interplay between your activity and your genetics. And what I mean by that is the same person who has the predisposition, that genetic aspect will be accentuated with poor mechanics. Or you know what I mean? Like, let's say, think about like a football player who's a linebacker, right? Those are guys like taking a beating to their spine, right? The guy with the really poor genetics for their disc will have way more of acceleration than the person who doesn't. So it's probably more like 90-10 in that scenario, right? So that ratio will change depending on your habits, lifestyle choices, and how much load you're putting on your spine.
Right.
So, but genetics is a huge part of it.
Okay.
It doesn't mean that there's nothing we can do about it, right? It actually means it makes it even more important for you to make those good choices and for us to guide our audience in terms of, and what I want to do with my patients and educate them, because prevention is ultimately the key, right? So getting to the sort of nitty gritty of like what's breaking down, we can break it down into those structures. So the disc itself, those cushions degenerate because they lose water content over time. There's a process called glycosylation where the collagen fibers within the disc itself, sugar molecules are attaching to them and it's making them dehydrated. It's making them stiffer, which then causes stiffness, right? The joints, those facet joints we talked about earlier, they lose their cartilage, they lose their fluid, they lose their lubrication, which then causes stiffness and pain. Then you have the muscular aspect of the spine that we talked about, and poor mechanics, like a weak core or hip, tight hamstrings, prolonged sitting, forward head posture, heavy repetitive lifting. These are where the contribution comes from those structures. And ultimately, then there's the lifestyle factors, things that are, sounds obvious, right? Obesity, smoking, sedentary lifestyle, heavy repetitive lifting, right? Or poor lifting, right? Like think of deadlifts. Like
Yeah.
I love to be fit. I've done CrossFit, I've done other forms of workout. And a lot of those injuries happens from poor form, right? Deadlift is actually a great exercise, but done poorly, it's horrible for your back, right?
Right.
That
Right.
load is going to be concentrated in that, especially the lower disc, that cushion in your lower back. So, to summarize this section, I would say most spine problems, right, aren't one huge injury. They're a slow drip of stress over years and years, sitting a lot, not moving enough, lifting or working out with poor mechanics, and sort of the normal aging of the disc and joints, right? That's a
Yeah.
way to sort of summarize that aspect of it. Um, then we want to sort of get to well, what's the sudden structural problems that we see, the traumatic things that we see, and it's not always like a high velocity injury like my brother suffered from. One terminology that a lot of patients have heard of is like disc herniation. Well, that's really just that jelly, that cushion is pushing out and irritating a nerve, right? If it hits a nerve, you'll feel it down your arm or down your legs. If it's more central, you may just have severe back pain that's very debilitating, causing severe pain. You can then develop, as a result of that, something called spinal stenosis, which is the narrowing of those nerves, which is essentially a blood flow issue, right? If they don't have as much room to breathe, well, guess what? You're going to have trouble with standing and walking because it's a perfusion problem. It's like you get chest pain if you're not getting enough blood supply to your own heart, right?
Right.
You get a heart attack, but initially when it's not as bad, like you'll get some exertional chest pain, let's say going up the stairs. The
Yeah.
nerves are the same thing. They're going to give the signal back to you to say, hey, there's a problem by hurting when there is not enough perfusion there, right? Then you can have instability, something called spondylolisthesis is a Greek term that means one vertebra, one building block is shifting in front of the other one, which can cause nerve pain and pain and pain, just mechanical pain, right? Then going down to the more traumatic aspect of things, right? You can have trauma or let's say compression fracture where the bone itself actually has failed from mechanical stress. Now, either because the stress was high enough to cause the fracture or the bone was weak, right? So building and maintaining a good bone density is a critical part of a good spine health. And I encourage all my patients to be very proactive. As a society, we're a little bit reactive in medicine, unfortunately, and we sort of wait until the patient's 60 years old to tell them, wait, listen, the past 30 years, you've been losing a lot of bone density.
Yeah.
Well, now do something about it. Where now your options are more limited, right? But if we can encourage patients to do weight-bearing exercises and really load their spine and their bones and make sure that, if there's hormone deficiency, vitamin deficiency, some of the identifiable causes can be reversed, it's much better to do that head on at an earlier age than to wait until your 60s to then try to medicate yourself out of that, right? And then we don't want to forget about the red flags, right? Things like history of cancer, unexpected weight loss, infection, fever, night pain. These are things that obviously you want to see someone quickly because those are not routine things that should be missed, right? We want to make sure that our audience is educated on that, right? Before I go to the next section, I just wanted to kind of make sure that you had no other questions.
Yeah. I
Anything
mean,
I
I
need?
have tons of questions, man. Like, I just think, but my goal always is I want the experts to talk and give their expertise, and then I jump in when appropriate. But we mentioned about spinal loading. This is something I want to get your opinion on, your expert opinion here. So you're talking about deadlifting, and my audience is obviously students, anatomy students are going to be in different healthcare jobs, but it's also personal trainers and different clients. So there's a lot of opinion out there about spinal load and compression on the spine. And actually, a lot of my colleagues who are very educated are moving away from a lot of heavy spinal loading with Olympic lifting, dumb barbell squats. Educate us on this, on what is potentially effective in doing this and what could be a tipping point for being not effective and actually causing harm to the spine with loading the spine.
I think ultimately in some ways it's complex, but in some ways simple.
Mm,
If you cannot maintain proper form on every single rep,
mhm.
then that weight is too much. So ultimately, what you need to do is first work on your flexibility, then work on the strength, and then build up to an appropriate level. I'm not a big fan either of heavy loads,
Yeah,
because life is a marathon, right? We're not trying to do the max load that you can do. I mean, I don't. At the end of the day, one of my mentors always says the end goal should be the first thing in mind.
mm,
Be- If you know what your end goal is, then you figure out, okay, what do I need to do to achieve that?
right.
And so the goal here is good health. The goal here is maintaining your bone density, maintaining your flexibility, maintaining function. And so I'm not there working out to impress anyone. And unfortunately, what happens is we're all competitive. I'm super competitive as well, right? And especially in some of these classes, right? You're like
Yeah,
putting max weight, max rep, and that's where people get into trouble,
right.
right? Like super athletes get in trouble because they're exhausted, they're fatigued, they're trying to get to certain target weight, and then their form is off, and it doesn't take much. Your form is out. You have this what we just talked about, this normal wear and tear, and so it doesn't take much for you to be over that tipping point,
Yeah,
right? So
yeah.
does it help answer that
It
question? So
does. Yeah,
I don't think it's because then you have to sort of watch it's very individual, right? Some
mm,
people have poor ankle motion, some people have poor hip motion. So for me to be able to then just guide big picture, it's impossible, right?
yeah,
Getting a trainer, working with a trainer, really individualizing it to each person is critical. There is not a one size fits all here.
yeah,
But if you have that guiding principle of maintaining flexibility where you need it to do that proper exercise is key, right?
yeah.
And you've developed in our practice something called like blood flow restriction, right? We have athletes
Mhm.
that can't, let's say, do a certain load safely right now because of the injury. Well, there's cheat sheets around that, right? You can restrict the blood flow, trick the body to be able to get the same results by restricting some of that blood flow,
Yeah,
right? So there are other very advanced ways that we can achieve those results, right? Without causing undue stress to the spine. And
yeah,
so that's the key is at the end, the goal is spine health or physical health in this when it comes to this question, but how do we achieve it without causing another problem, right?
yeah.
Which actually flows really well into the next topic, which was prevention and sort of everyday health, spine health. What can I do before someone can meet me in the clinic, right? Um, one one area is really sounds kind of obvious is just regular movement. You don't want to be sedentary, right? You don't want to sit for more than 30 to 45 minutes. So one area where I've seen a lot of improvement is, a lot of patients now have stand-up desks or this desks that go up and down. So they're not
Yeah,
in an office. As a surgeon, I'm not sitting down much, right? Just because I'm operating, I'm going between rooms, seeing patients. But that could be a lot more challenging for someone who sits at a desk, right, in a cubicle or an
right,
office, right? So I think a stand-up desk, they have those walking treadmills now where you can stand and actually move your legs.
right.
The body is meant to be moving, and the more stationary it is, the more static it is, it becomes more prone to injury because those joints become stiff, the disc becomes stiff. They don't hydrate well when they're stationary. And then you get up to go do something very, very menial, like very ordinary. And that's how people actually injure themselves.
Yeah,
it's usually not, hey, I went and did a deadlift and boom, I'm
Yeah.
injured. I bent over to brush my teeth. I bent over to pick up the trash. It's very mundane
I hear that all the time too.
stuff, right?
Yeah.
So, but the way you prevent it is by moving. Keep yourself moving, and not just I'm talking about exercise. I'm talking about everyday stuff,
Yeah.
right? Um, Strength training is a second topic and sort of what we were talking about before, but really focusing on the core. So, do I love weight training, Olympic weight training? Yes, but not before you've built a really good core. So I got into yoga 6 years ago, and it's tremendously helped me, with some of my own pain that I have in between my shoulder blades, my back from standing as a surgeon bent forward. So working on core, and it doesn't have to be yoga, it could be Pilates, is critical because the core is is the muscles that we just talked about that supports your spinal canal. And it's like an analogy I give my patients is, you see those massive trees with those massive branches. Well, they can't have those massive branches if they don't have a strong trunk.
Right.
It has to, right? It has to be proportional. If you have a branch that's too big relative to the trunk, it's going to fail, right? The trunk will fail. And the spine is the same thing, right? If you just go in the gym and you're just doing biceps and triceps and shoulder press and leg press, but you haven't worked on your core, well, guess what? You're going to
Yeah.
injure yourself, right? And so that's really important. And core doesn't just mean the abs. I'm talking about the back muscles, the glute muscles, and the stabilizers, the scapular stabilizers is really important. And then lastly, we talked about this a little bit, is flexibility, right? Hamstrings, hip flexors, a thoracic spine mobility. Because if your hips don't move but well, when you go to pick up something from the ground, you're loading all your spine on that. You're
That's right.
bending back, which then is what we were talking about earlier in the interplay between genetics and wear and tear. Well, if you have poor hamstring motion or hip motion, then you're going to put a lot more load, and it's just the cycles of life. Eventually, you're going to accelerate that and cause problems, right?
Right.
So to summarize this, I would say your spine loves motion, right? Long stretches of sitting in the slouch position it's like a rest for your back, right? Um, Short, frequent movement and breaks and basic strength work are some of the best medications really we have for our spine, right? Because there is no good medication that's going to solve this
Mm.
issue. Patients are always asking me, Doc, well, what can you give me that's going to so I don't have this backache anymore?
Yeah.
The problem is these medications, they all have their trade-offs. And if you don't go to the root cause of the problem, yes, we can give you medication to help reduce inflammation, but those medications also have side effects. So they're not a good long-term solution. The long-term solution is prevention, so you can stay out of my office, right? I mean, that's
Right.
really
Yeah.
uh, the other part of this is ergonomics. We talked about this a little bit. We talked about the desk setup, screen, being eye level,
Yeah.
having good lumbar support. You can even put, these chairs that I'm sitting on right now has nice support back here, but you can put a roll of towel to make sure that arch of your back and the lower back is well supported. Um, Hinging at the hips when you're going to pick something. So we talk about mechanics now. You can do lunges, squatting, right? That's where knowing how to do a proper squat is so
Right.
important, right? Because that's really how you should be sitting. And then sleeping, right? You want to have a good, firm mattress to support your back so that your back isn't slouched in. Side sleeping versus back sleeping is a huge question I get all the time. I think back is obviously ultimately better because if you're a side sleeper, typically you're just sleeping on one side, so then you're
Right.
gonna create a differential force over many, many cycles that can be harmful, right? Um, so back sleeping in a good, firm mattress that gives you good support is very, very critical. Um, then the lifestyle factors is the last pillar of this, right? Weight control. Um, it sounds obvious, you know, and that may be obvious to me, right? The problem with extra weight, especially if you're carrying it in your belly, is the more force you're putting away from your center of gravity, the more stress your spine is withstand. And so it goes back to that interplay between wear and tear and genetics. Well, the issue is weight problems is partly genetic too, right? So that's where it gets very complicated,
Right.
right?
Yeah.
Um, Now there's been tremendous, obviously, progress over the past, I would say, decade, especially with now the GLP direct
Hmm.
medication, where that's helped. But ultimately, those are just medications to help you get to a better, to basically dial down that thermostat. But you still have to make some of those lifestyle choices, like eating better,
Right.
exercising better. We didn't talk about sleeping yet, but sleeping is so critical to spine health because it allows your disc to rehydrate. It
Hmm.
allows for your immune system to regain its function because everything in life and every disease process within with the body, including the spine, is this fight between inflammation, anti-inflammation, and right. And so sleep is very critical to reduce your stress levels and allow your body to recover. And so we want to be active, but we also want to give our bodies some time to rest. And that's when
Yeah.
good night's sleep is critical. I mean, some people need 6 hours, can go by 6 hours. Some people really need 8 hours. That's where the genetic difference is also
Yeah.
to play. Um, the last thing I would uh, give the audience is, you know, break it down to simple, maybe one or two simple things that you can do every day, right? That's part of your routine. One thing that I like to do is after every meal, go for a walk. Just 5 minutes, 10 minutes,
Yeah.
something, because that's actually the time point where your glycemic index, the sugar levels in your bloodstream, is going to shoot up because you just had food. And that's what you want to try to modulate as much as you can, because that's where the cascade of your body needs to then bring the sugar levels down. It's going to pump your insulin in your bloodstream, which is the hormone that's meant to reduce your glucose level, which then causes some of these other issues, right? Because insulin is also what triggers your body to want to absorb everything and store fat. So that's why like high fructose corn syrup or
Hmm.
high or foods that have a high sugar content. No, not just high sugar content, but sugar that rapidly gets absorbed and increases what we call the glycemic index
Hmm.
is so harmful. And so having some routine, such as walking right after a meal, um, stand up and walk during phone calls, right? Simple things that, these are things that if you make it a habit, then you're not even thinking about it. It doesn't sound like work where you got to go to the gym. You
Yeah.
know, those are things that patients can do to help with that prevention piece that we talked about. Um, any questions on this topic before we,
Yeah.
what,
Before we move on, this one I think is pretty universal because anybody who listens to this is probably experienced this, what I'm going to ask you. But we had an episode back about digital posture dysfunction and the tremendous effect that phones or smartphones have on deep cervical flexion. What do you make of this? Because I'm seeing this way more with clients, with students, really young people who are like, my neck is killing me because they're always just looking down all the
oh yeah,
time.
yes.
Are you seeing this a lot in your practice? And if you are or aren't, what's your suggestion on this? Because this is something so many people do, and they're looking for ways to break out of it.
Yeah, I think it's one of those. I have seen it more. This question has definitely come up multiple times. I experienced it myself as a surgeon just because we look down a lot to do
Right, right.
surgery. And one trick that we have is, we wear these loops, these magnification glasses. And so I had to get them adjusted so that you're looking here, but you're looking down. It has like an angle
I
in it,
see.
right? Or I use the microscope, which then allows you to basically stand like this, like straight ahead, looking straight ahead, but you're looking down,
Yeah,
right? So 100% looking down, whether that's your phone, you know, depending on your occupation, is going to create increased strain on the muscles, the ligaments, and the disc in your neck and cause problems. And so there are habitual things that you can do, or everyone can do to help solve that problem. For example, there are holders for the phone, like I have one right here, that you can
right.
set your phone that elevates it so that you're not looking down. Um, if you're sitting on a couch or a chair, holding your phone up or having again, a place for it, let's say on the kitchen counter or on the table, again, to elevate it. So there's things where you can do to help try to minimize that as much as possible. Um, because there's no reason why you can't use your phone without just constantly looking down,
Right.
right?
Yeah.
I think technology is also getting better, right? With the AR glasses.
Mhm.
I think some of that there are solutions. I think the first step is recognizing there's a problem, right? And hopefully the audience listening to this becomes a little bit more mindful about those type of habits because again, the key is prevention,
Yeah.
right? Because once you recognize there's a problem, and then now you're thinking about the goal, there's a solution,
That's right.
right?
Yep.
Just for sure. Um, so I wanted to kind of sort of talk about, well, what do I do? How do I approach patients with spine issues? And ultimately, it comes down to the story, the patient's story, their journey, really understanding the onset. Where is the pain? What activities worsen and relieve it? What do they do for a living? What are their hobbies? What are their goals? Right? Because if you don't understand the story, you don't really know what the goal here is. And without a goal in mind, like I said in the beginning, you're sort of lost, right? A lot of times, patients, have come to me. Well, I got this whole body MRI, right? They're doing longevity care, and
Right.
they're freaking out because, the radiologist wrote all sorts of, jargon there that they can't understand. Well, this is broken down, that broken down. But the MRI is just a picture. It doesn't tell you the story. You can have an MRI where all the discs are worn out and the patient has no pain. They're fine. They're doing their activities. They're going on their vacations. They're going to work. They take care of their family. They have minimal discomfort. Then you have another person with MRI where only one disc has a problem and they're in debilitating pain. I mean, they can't even do the basic things around the house, let alone go and work out or have their hobbies in place. So at the end of the day, the number one thing is understanding what is the patient's story. You got to meet the patient where they are, understand their goals. Um, Obviously, we're going to examine them, look at as many data points as possible to then try to correlate the clinical picture with the physical and radiographic findings, right? Because you want to understand what the structural problems are, but you want to understand, well, out of all these structural issues, because some of it is normal wear and tear, well, what's
Yeah.
actually causing the functional issue so that you then come up with a correct diagnosis to understand, well, what's causing this patient suffering and how can I help them? Because if you don't get down to that nitty-gritty aspect, there's so many solutions, and to perfectly get the best result for our patients, we're trying to match the best solution, right? If a physician or surgeon just has one tool and unless the screwdriver fits for every problem, that's all they can do, then they're very limited, right? And unfortunately, either they can't help the patient or they do the wrong thing for the wrong
Yeah.
reasons. So, we really want to make sure that even before we go down to the surgery aspect, that we have a non-surgical toolbox. And that's really what differentiates myself and the practice is we have a huge focus on holistic care, physical therapy, dry needling, laser therapy, hyperbaric therapy, all the way to regenerative therapies like PRP, that's platelet-rich plasma that's obtained from the blood, or bone marrow concentrates, because these have growth factors and very anti-inflammatory effects. And for the right issue, right structural problem, let's say tennis elbow or a golfer's elbow or Achilles tendonitis, where it's a collagen fiber disorganization, PRP can be an excellent solution. Or for small annular fissures within the disc, the bone marrow concentrate can be very life-changing and really avoid surgery. If, once you've addressed mechanical, physical strength issues with good therapy, right? So you really have to have the ultimate, I would say, non-surgical toolbox, you know, to be able to make sure that you're um, providing the patient with all these different avenues to really try to avoid surgery if you can, right? Can surgery be an option for certain individual? Yes, right? If there's a structural issue that's causing major neurologic issues, or there's a structural issue which is causing major instability for the spine, or there's a structural problem where it's too far gone to do the regenerative treatment. Let's
Right.
say a disc that's worn out, it's that's not functioning well anymore. Can we replace it, right? Motion preservation surgery is one of the areas of my expertise, where we can take let's say a damaged disc and put a prosthetic that now moves, right? Believe it or not, that's been around for a long time, but in the
Mm.
US, probably less than 5% of surgeons still do it routinely. Um, we can definitely get into why. It's harder to do. There's a reimbursement issue with a lot of insurance
Right.
companies. So Europe is far ahead of the US in this respect. But there are a few leading centers, including ours, where we do a lot of this replacement surgery with very high level of success. Because at the end of the day, you have to do a lot to be good at it. You have to understand when is the patient appropriate for it. You have to have the whole gamut of the regenerative options and non-operative options to then make sure the patient gets good results. Because even with surgery, if you don't have good pre-rehab and post-rehab and a recovery program for the patient, you're not going to get a good result.
Yeah.
Recovery piece is such a big part of that. Um, and so, that's sort of my philosophy and approach in terms of how I approach that patient. And, when is it elective? When is it really an emergency? It comes down to infection, major neurologic issues. Obviously those are urgent. You got to take care of it. There's no question. But most of it that becomes surgical is elective. We've exhausted some of these other options. And then the question is, how do we provide the most cutting edge option that helps our patient get back to the function that they want? What are their goals with the longevity, right? I'm not interested in doing something that I know in a year or two that thing's going to fail,
Yeah.
right? So I want that perfect balance between the least amount of downtime, but I also want to give a solution that has longevity for the patient. Um, what is, I want to make sure that this part is well covered before we go on to the next part. The last area that I wanted to cover was some of the myth busting, some of the common misconceptions
Yeah.
that I hear.
That would be
Uh,
great actually, because I know where I want to respect your time and I know we're here for an hour, and so we have like 8 minutes left. So I want to
okay.
make sure we get
So let's
to
talk
those
about the
things.
myth busting, and then we can wrap this up.
Yeah.
It's been a very good conversation. Um, so I'll give you some of them. One is, well, if I have a herniated disc, that means, I need surgery. Well, in fact, that's not true, right? Not more than 90% of disc herniation, they can get shrink, they can get smaller. It really depends on the herniation and the subtype of it.
Mm.
Um, the disc isn't just one thing. Is actually the cushion that we were talking about has a outer shell that's much more firm and gives the tensile strength to the disc. And then there's an inner piece called the nucleus pulposus, which is much more gelatinous. So if there's a tear in that outer ring and that the little jelly comes out, that actually has a much better prognosis of getting better without surgery, right? Because the body, the macrophages, those little
Yeah.
inflammatory cells can go eat it up. So as long as there is not causing major nerve issues like weakness and foot drop, a lot of times what we're trying to do is really try to temporize the pain. We can do injections and therapy to try to buy the person time. It's kind of like when you get a cold and we're doing all this home remedies to essentially just give your immune system a
Right.
chance to catch up, right?
Right.
And so that's one area of myth that, that I get all the time.
Yeah.
The other is, well, rest is the best treatment for back pain, which is not really true. In fact, being too stationary for most instances, I don't want to say for everything, movement is actually better, right? So even if it hurts a
Right.
lot, better to move. Sometimes I'll get my patient into something called aqua therapy, or just get in a pool, just walk in a pool, because the water takes away the gravity, and so then the patient can move. So movement is usually better. Um, Another one is, we kind of touched on this a little bit before, but my MRI says I have all these degenerative changes, so my back is ruined. Well, no, we all, we talked about the wear and tear. We all are going to have some physiologic normal wear and tear that happens no matter what. And so again, MRI is just a picture, it doesn't tell you the
Yeah.
story. Um, Another area is another myth that I hear all the time is, well, if I have, this cousin of mine or this friend of mine had, 4 surgeries now, well, then, back surgery gets really bad name for multiple reasons. But one of them is, well, they had back surgery, then they had another one. Well, the first surgery then caused the second one. In the mind of the public, that's what's
Yeah.
happening. You know, a corollary to that is, let's say you're prone to dental cavities, right? You get a cavity in one year, and 3, 4 years later, another one pops up, and you get another cavity filled. Well, for some reason, that's very understood because we understand. Well, this is one tooth, and now it's another one. It's not like the dentist caused the other cavity.
Yeah. Yeah.
The spine, people see it as one unit, but it really is multiple segments, just like your teeth are. And so some of the issues is that it's just a natural progression of disease. And so a lot of times, the reason people are having multiple surgeries over, let's say, a 20-year period is because another level is just breaking down.
Yeah.
The same underlying issue, whether that was genetics, activity, lifestyle choices, is some of that is from that. Now, there are ways to do things like, we talked about motion preservation. If you can maintain motion, you're going to reduce that progression, right? So that's better than a fusion, or the way you even do the fusion surgery itself can be done in a much safer way now, like robotic technology,
Mm.
doing the spine, the surgery from the front of the spine where you not have to go through muscles. So there's ways to not add to the problem, but that is a huge misnomer that, okay, if I have surgery, that means I'm essentially destined to get another one. Um, so the answer is way more complicated than that.
Yeah.
Right? And so I wanted to make sure I sort of address that because I hear that all the time, and it's good for the audience to hear that.
Yeah.
Um, so to summarize this segment, um, I want the audience to come away with understanding what the spine does. What are the common patterns of breakdown, right? So we talked about form, function, flexibility, core, right? You want to maintain that good core. You want to build your trunk before you build your extremities. The goal is spine health, not the max weight that I can do. So you have to have good, you're right, like stretch out, warm up first, work up to a comfortable weight where you're not losing your form. Um, we talked about protection by moving regularly, strengthening, watching your posture, your ergonomics in everyday habitual tasks, right? Um, in terms of how do we respond to it, don't panic with pain. It's very common. Um, Adults in the US, up to 60% have some severe bouts of back pain or neck pain because of this underlying aging that happens. But definitely seek help. Make sure that the center that you're going to is well versed with all the conservative options, right? There's a lot of very advanced tools now, um, within physical therapy, within physiatry, within spine. An institute like ours that sort of has it all is sort of what you want to be looking for, so that you're not getting pigeonholed down to one path and only one solution. Surgery is just a tool. It's not a failure, right? There are specific situations where the benefits do outweigh the risks. It can be a successful, very life-changing thing. And one of the most gratifying things I can do is get someone from point A to point B where we've exhausted some of these other options. And so, I'll leave you with this. If you're dealing with back or neck pain, remember your spine is not broken. Just because your MRI has some big scary words on it, there's a lot that we can do before surgery. And when the surgery is the right tool, it's because we've carefully matched the problem with the solution. Right. So I hope the audience enjoyed the segment and took
Awesome.
away from it. Again, my name is Eshan Jazini, and here at Virginia Spine Institute at VSI in Northern Virginia.
Thank you, Dr. Jazini. That was awesome. Uh, so many people are going to benefit from this, me included. I'm so happy that you gave us some of your valuable time. I know you're often running to the next patient and the next discussion. So thank you so much. I appreciate you tremendously.
God, thank you for having me and enjoy your rest.
You got it.